A lot of older professors or people who have been in nursing for 20 plus years think that medsurg is where everybody needs to start. Mm-hmm. And I think it's really interesting because with your experience, you said that those nurses are typically not successful in their transition.
Mm-hmm. Wherever it is that you want to be, if it's peds, if it's ER, if it's critical care, start where you want to start.
Because it's very competitive to get in.
It is very competitive.
What are the biggest things that you think that they could start doing now while they're in nursing school or while they're working, in medsurg or another unit to hopefully get a job in NICU?
Okay.
So how would someone know that NICU is for them? Can you explain what the different levels of NICU mean and what you would aim to get in as, I guess, like what's going to be the most difficult or challenging experience? What's going to give you the most range of patients, the sickest patients? So let's talk about that.
Okay, so let's talk about it. So I feel like level 2 and 3, or actually level 1 and 2 of NICU are mainly like your door feeders. It's more like a nursery. So think of it as a baby that's being born and maybe they just need a little bit of help feeding, or maybe, temperature is not where it needs to be. Babies have a range for a certain temperature that you want to keep them at. It's very, very important. So when I think of a level 1 and level 2, it's mainly just those kind of babies. They just need a little boost. When you think about a level 3 NICU or a level 4 NICU, now you're getting into our very critical patients, our very critical babies who require a lot of respiratory support. They have a lot of congenital defects or anomalies. They require surgeries. Level 4 is going to be the highest NICU that you can get into, and they have a range of things. They have a lot more, honestly, that you will see and do in a level 4 than a level 3. However, level 3 is still very, very critical. Me personally, I would aim for, honestly, kind of depends on your goal. So if you're thinking you want to do a neonatal nurse practitioner, I would aim for a level 4. If you're thinking like I like NICU, but I just can't see some of the surgeries happening at bedside, it might be a little bit too heartbreaking or a little bit too critical, then I would aim for a level 3. But essentially level 3 and level 4 pretty much kind of do the same thing. It's just that on the level 4 you really will see those bedside surgeries and maybe a lot more like medications and drips and things like that.
Told me that it's very difficult for a lot of nurses to transition from places like medsurg or adult ICU over to neonatal ICU, and I think that's really interesting because a lot of older professors or people who have been in nursing for 20 plus years think that medsurg is where everybody needs to start. Mm-hmm. And I think it's really interesting because with your experience, you said that those nurses are typically not successful in their transition.
Yes, so I first will start by saying that I don't believe you should start in medsurg. I believe that wherever you want to go, wherever you want to be is where you should start. Do not listen to people that tell you, oh, you have to start in medsurg. Absolutely nothing wrong with medsurg. They get a lot of great skills, but in my personal opinion, wherever it is that you want to be, if it's peds, if it's ER, if it's critical care, start where you want to start. In my experience and from what I've seen, just as being a NICU nurse, I feel like people that come from other specialties, mainly adults, they struggle a little bit just because it's a whole different world. Babies are a whole different world. They're a lot more critical. You have less room for error. And then you have parents at the bedside all the time. And so when you get used to adults, it's like you go in with a mindset like, oh, I'll just treat this as if an adult. But no, you can't do that. Like, these are literal babies. These are somebody's child. You have babies literally the size of my hand, believe it or not. So you have to be way more careful. It takes a lot more learning. The saying, it's hard to teach an old dog new tricks. That's honestly kind of how it is. And I'm not saying that you can't come from a different specialty and be successful, but it is a little bit harder. And in my opinion, I've seen it not really work out well for other people that start in other specialties. However, if you are in women's services, so labor and delivery, mother baby, I think they end up making very wonderful and great NICU nurses.
In a lot of places, you could possibly do share time if you're interested in transitioning over to a new unit or you're interviewing. Mm-hmm. Do you feel like that's still a possibility for NICU or even for labor and delivery to do share time and maybe spend time on the unit after you've interviewed, of course,
yes,
with the nurse manager? Is that something that you see like people doing on your unit when they come and interview?
Not really. I'm not saying it's not possible. I just don't see it as much. However, I feel like you can always go to your manager and always say, hey, like, I think I'm interested in NICU, you know, and we've had a few nurses that will come down and they'll come and shadow one nurse just for a few hours, maybe 4 or 5 hours, and just kind of see, you know, how they like it and what we do. It's not always common, but it's not impossible either. So yeah, it just kind of depends, honestly.
Okay. So if someone was interested in making a transition from, you know, med-surg or anything, because it's very competitive to get in.
It is very competitive.
What are the biggest things that you think that they could start doing now while they're in nursing school or while they're working, you know, in med-surg or another unit to hopefully get a job in NICU?
Okay, so if you're in nursing school and you have an interest in working in NICU, I would say to start an externship. Get into an externship. Get a position at a NICU where you are at least getting the basics or the foundation of what it is to be a NICU nurse. A lot of NICU nurses actually start externships, and it doesn't necessarily have to be at a specific hospital or even, you know, a hospital with a certain level of acuity, but just start an externship. If not, I would say find NICU nurses online. Like, there are so many different resources, and just talk to them. Ask them questions. Hey, is your job hiring? Do you know when they'll be hiring? Is there a job fair? And it's the same thing if you're coming from a different specialty. Get to know somebody in that specialty that can go to their manager and say, hey, like, I have somebody who's interested. Can they come down and shadow for a little bit, you know? Or if a position opens, like, would you be interested in having them interview and, you know, come work in the unit?
Okay. So what do you feel like are the skills that you could take from NICU and go anywhere?
Honestly, all the skills. Because we do such very, like, intricate and very delicate things with babies, I feel like it makes it a little bit easier in our transition versus if you were coming from adults and then trying to come to babies. We do pretty much everything. Like, I, you know, put IVs in baby scalps and do things like that. And so I feel like a lot of the skills that I have can definitely easily translate to other places, especially on an emotional level. Like, we see a lot of, you know, disheartening things sometimes, and I think that it helps when you have adults, and then I can say, oh, well, I've seen that in babies, so I'm not as emotional, I guess.
So are the ratios different for nurses to patient on like a level 3 and 4 versus a 1 and 2? Obviously, since the patients are less acute, you know, is the ratio different?
So I would say yes. Even in the level 3 NICU, we do have a grower feeder side. And so I'll use that example where I would say on our more critical care side, usually there is 1 nurse to 1 baby or 1 nurse to 2 babies. It just depends. However, on the grower feeder side, you can see easily 1 nurse to 4 babies. That's usually the most we do. We don't do more than that. But usually, depending on the critical care, you know, what the baby requires, the acuity of the baby, usually 1 baby to 1 nurse or 2 babies to 1 nurse.
Okay. So for people who might not have an experience, like an encounter with someone who has a child in NICU, they might not know if they would like that setting. Because, you know, in nursing school, we don't actually get experience in NICU at all. And most of us in L&D barely get any experience. People like, don't touch me. Don't. I don't want any students. So how would someone know that NICU is for them?
Honestly, I think it's one of those things that you just kind of have to try. It's nothing wrong with getting into a specialty, NICU especially, and realizing that, okay, this might not be a great fit for me. We've had nurses that have started in NICU and they're like, okay, yeah, I cannot do this, and they will easily go and move on to somewhere else. So I feel like it's nothing wrong with absolutely trying and deciding like maybe I want to try this. Like, you're going to try a lot of different things in life, and some things you're going to like, some things you're not. I feel like for me, coming from a place of being in nursing school, you get very minimal exposure to pediatrics, very minimal exposure to neonatal. And so for me, it was a whole new world. Like, when I started, it was nothing like adults. It was nothing like what we learned in nursing school, what we saw in the books. Like, it was a whole new world. Like, take everything out of your head that you learned in nursing school and erase it, because NICU neonatal is different. So, yeah, it just kind of depends on you, but I think, you know, you really just want to try. If you can get some exposure, like I said, an externship, or even just a few shadowing hours, or even, like, there's so many resources where you can go and, like, watch videos on YouTube or something. Like, find somebody that can talk to you about what it's like to be in the NICU as a parent or as a nurse, you know. Yeah.
And I even think that there's volunteer opportunities like in the NICU and so many hospitals. So I think that sometimes we get caught up, especially new grads. I feel like they're so afraid of making the wrong decision and the wrong choice. And I want to emphasize, and this is coming from a management perspective, because I did, you know, I was a manager, I was an admin. I think we have to realize that as long as there aren't behavioral or ethical issues with a nurse, if one of my nurses came to me and said, you know, psych is not for me. Like I'm tired of keeping my head on a swivel, you know, the restraints and delusions every day. You know, I have no choice but to respect that. And of course I would give a good recommendation or a letter of recommendation, you know, if there weren't like ethical issues. You know, and I think that we have to just remember, just show up as your best self. And if it doesn't work out, it's okay. It's just like relationships. Sometimes you got to kiss a couple frogs to get to the prince.
Yes.
So I think that we have to just get out of our like own heads and realize it's okay to not like something, and it's okay to realize, you know, get in something and be like, I don't like this.
That's true. I agree, because there have been a lot of things in life where I'm like, I don't like this. When I say I don't like something, I'm not doing it no more. I'm just gonna move on.
But that's the great thing about being a nurse. You can literally wake up and be like, I don't like this anymore, and go somewhere else.
Yes.
Yeah.
Your degree will take you a number of places. Wherever you want to go with a nursing degree, you can go.
Yeah. So the last question is, what do you feel like is the hardest thing about your job?
Hardest thing about my job is losing babies, or babies passing away, I should say. I think that it takes an emotional toll on you because you don't expect babies to pass away. When you think of a birth, you think of something, you know, beautiful. Like a baby is being born into the world. They're gonna grow up and be, you know, a NICU nurse, or grow up and be a doctor, grow up and be anything they want to be. You don't ever expect to have a mom, you know, give birth and, you know, the baby's premature or has, you know, a number of illnesses or conditions, and then doing everything that we can do, you know, everything within our power to, you know, help these babies succeed and go on to live healthy lives. And they don't do that. I think that that's the hardest part of the job, and then still having to show up. Like you still have to show up for the family. You have to show up for all the other babies on the unit. You have to show up for your coworkers. You just have to show up to work. Like I think that's the hardest part, because we don't always get to take a mental break or a mental step. You have to keep going. Like I may have to go to work tomorrow. I've had plenty of days where I've lost a patient and I still have to show up to work the next day. And it's like, yeah, I can go home and I can cry and I can vent about it to my, you know, to my people. But at the same time, it's like, wow, I still have to go back to that place tomorrow and show up all over again for a whole new parent, for a whole new patient, for a whole new baby. So that's the hardest part of my job.
So what resources do you feel like someone should know about, or any like conferences, anything that people should possibly pay attention to if they want to be in NICU, or possibly like advanced? I don't know if you know about like neonatal nurse practitioners. Like what things do you think they should be like on?
It's a good question. So Instagram is a great place to be, because there are a lot of newer like neonatal nurse practitioners, or even NICU nurses that have years and years of exposure and experience, and they're constantly daily creating reels and videos and things just to kind of give you an idea of what it is to be a NICU nurse, or even from a parent standpoint, what it is to have a baby in the NICU. I feel like we do have a lot of neonatal conferences. Granted, you know, you don't always have to be a member, but it would be great to be a member of some of those things, because they send out like newsletters and magazines and things. I feel like with the NICU world, and I'll be honest and say it's not as established in my viewpoint as adults, where I feel like there's a range of things for adults. Like I'm currently studying for a test, and there's all these things for adults, and then when it comes to like the neonatal world, there are very few like resources. I think it's still something that's very up and coming, still a lot of research being done. So right now I kind of just use the people around me that I know that have had years and years of experience, or I'll at least go to them and say, hey, like, can you refer me to somebody that can answer these questions or do these things? So sometimes you really just have to network and use the people around you. But I also would encourage definitely trying to find, you know, even like doctors, like neonatologists are really, really great resources to use. You know, obviously being a nurse and a doctor is, not necessarily too different, but there is a line between the both, and they can still help you with some of the things.
That's amazing. Well, thank you so much for
Thank
coming.
you.
And where can the people find you? How can they connect with you?
So my name is Deira, and I'm on Instagram as Deira Lene. So if you want to follow me there, you most definitely can.
All right, perfect. Well, thank you for coming and being on the show.
Thank you.